We are at Unity Point Health St. Luke's, and I'm with Dr. Subhas, and you're going to tell us all about something that we really need to know about, which I know about, which I know that some people have forgotten during this period of time, because I know that when we're sitting at home, we think, oh, I'm not going to get sick, nothing's going to happen to me, because I'm not going out among people. But there is something that you really need to pay attention to, and that's your colon, right?
That's correct.
And this is kind of the time of year when we bring your attention to that. But what age do you really need to be concerned about your colon if you haven't had any problems?
So right now the guideline states that when you turn 50 years, that's when you should go for a screening colonoscopy. Maybe in future they might bring down this age to 45 years because they're seeing more younger people being diagnosed with colon cancer.
And what are some symptoms? What would be things that I would notice that maybe I might be young and I'm having those problems?
So the warning symptoms would be definitely rectal bleeding, which is totally unexplained, weight loss, unexplained, abdomen pain, changes in bowel habits, like all of a sudden you are having normal bowel movements and you are starting to get very constipated. Those are kind of some of the typical warning symptoms that you might have a colon cancer.
And if you had any of those things, anyway, you should get that checked out no matter what, right?
That's correct, yes.
Okay, so then let's say I'm okay. In my own life, I've had colon cancer in my family, so I had to start earlier because my sister had colon cancer, and they said, you better get checked too because it could be running in the family. Is that a common thing?
That's right. So having a first degree family relative with a colon cancer puts you at a higher risk of getting a colon cancer. The average person has a risk of getting colon cancer, which is 1 in 20. But if you have a first degree relative with a colon cancer, your risk becomes 1 in 3. So
oh, wow.
So that kind of exaggerates your risk.
Okay, and now we've all kind of figured out that, oh, this is the worst thing. I don't want to go through it. It's terrible. Help me. But it isn't that bad, is it?
It's not that bad. A lot of people, when I first tell them about colon cancer, I see anxiety on their face, and then I try to explain to them that this cancer, if caught early, really the treatment is very good. You pretty much can get cured of this cancer. Even in later stages too, there are good medication which can keep you going on for a long time. So it's not a bad cancer compared to some of the other cancers.
So, see, it pays to be vigilant about things.
Yes.
But then what happens when we go for a colonoscopy? Everybody complains about that, right?
So
but again, I don't think it was that bad.
No, it's not that bad. So there are a lot of myths associated with colonoscopy. The myths are, some people think that the bowel prep is bad. So olden times there was just one option, drinking a whole big gallon of Golightly, which I haven't not tasted, but people say it has got a very bad taste.
You never had it?
No, I never had it.
Oh, it's the worst. It is the worst stuff. You think if I have to drink one more thing of this, I'm not going to make it.
So thankfully there are newer versions available. We call it low volume prep, and again, I have not tasted any, but patients who have tried the old fashioned Golightly and the newer one, they definitely say
How
that in
can
future.
you call yourself a doctor if you haven't had a taste of this stuff?
I always think that I should go and taste it, but maybe one day I'll do it for sure, yes.
Okay, when you get to be 50, right?
Yes.
Then we're ready for it.
Yeah.
Okay, so then we have this prep where we drink this thing.
There are better preps available, low volume preps available, which patients tolerate well. The other myth is that it's going to be painful. So in the past, some people did it with just some light sedation, but nowadays everyone is using the help of anesthesia, wherein they use propofol, and that's pretty much like a switch. Once propofol goes in, your switch is turned off. You don't know anything.
You're
you don't
just
remember
sleeping.
Anything. Yeah.
It's probably the best nap you've had for a long time.
And that's what Michael Jackson used.
Oh no, really?
And it was unsupervised, so that was a bad thing. But here we have trained people, anesthesia people monitoring you while you get this propofol, so that's pretty safe.
And then tell us what you do while we're out napping.
Well, we have we do the scope, and while we do the scope, we have a good look in the colon, and also we have some social chat too.
Okay, so then you can look and see if there are any problems, if there are polyps. Is that what we're looking for?
So what we are looking for is polyps. So before any cancer develops, it starts off as a polyp. So I tell patients that it starts off as a bud, and then that polyp is like a bud. And if you see them, they're generally like small in size, usually ranging anywhere from 5 millimeters to 10 millimeters in size, and we take it off with a snare.
So you can do it while we're doing the colonoscopy?
Exactly.
Oh, that's great.
So we take it off with a snare. So that's the end. So before it forms cancer, we kind of end it there itself at a bud stage, and that's the end of it. So that's why we stress on doing colonoscopy, and we say that colonoscopy prevents cancer because it kind of prevents that polyp from developing to a cancer.
Okay, so I have it at 50. how then often do I need to have that?
So it depends on what we find in your first colonoscopy at 50. It depends on if we don't find any polyps and you are an average risk, that is you don't have any family history of colon cancer, then you need it every 10 years.
10 years.
Yeah, but in case we find polyps, depending on the size and the nature of the polyps, it can be anywhere from 3 years, 5 years, or sometimes 6
Okay.
months to a year. And if you have family history, then you need it done little sooner, like every 5 years.
Okay, now let me show us in your office. We want to see what this all looks like, because this can be very scary for some people.
So this office is this is my examination room in the office. When any patient comes in with rectal bleeding, I call it like a one-stop shop for the initial examination. This is the examination table. My instruments are here. I use the endoscope to make sure that they don't have hemorrhoids. And this is like when somebody comes in their 20s and 30s, the likelihood of them having a colon cancer is very less. It's most likely a hemorrhoid-related problem, so good history. An examination can save them a colonoscopy. We don't really need to subject them to a colonoscopy at 20s and 30s if we know what's causing the bleeding.
If we do have something like that, bleeding or hemorrhoids or whatever,
Uh-huh.
what would be the reason for that at a young age?
At a young age,
Is it just a bad diet? Is that usually
yeah,
it?
bad diet and the kind of the bad bowel habits. It's mostly constipation which causes hemorrhoids. There are some people who just sit and spend like 20 minutes, half an hour in the toilet seat sitting and straining. That really puts a lot of pressure on those hemorrhoids, which are essentially blood vessels or vascular cushions in the anus. They get enlarged, engorged, and then they start like they burst open and bleed. So if what generally I advise people is make sure you don't get constipated, make sure you don't strain, drink a lot of water, take more fiber in your diet, and that really helps.
So drinking water is key.
Yes.
And fiber.
Yes.
And I'm sure we don't get fiber in fast food. We don't get fiber in a lot of things, right?
Definitely not. No.
So that's when I'm young, if I see any of these kind of problems, and I know that people freak out. I know that they go, oh no, I'm bleeding, what does this mean? But it could be something that's just really nothing.
Yes. Most of the times it's nothing, but then in some cases, rare cases, we do see cancer in 20s and 30s. So you should not totally neglect it. You should seek attention.
Always, if you see something that's
Yes.
not the run of the mill, it's not,
Yes.
it's irregular,
Yes.
we should see you.
Me,
Okay,
yeah.
so then when we're getting, let's say you have found polyps on us.
Uh-huh.
What do we do then? After you've
So-
taken them off, do we watch then a little sooner, or?
Yeah. So while we're talking about polyps, I can show you a picture here. I have this one. So this is how the polyps look, like small kind of like bud kind of thing coming out from the colon. And then as time goes by, if you see these are the stages of cancer. The cancer will start off as a polyp and then keep progressing until it spreads all over your body. So if we see polyps, then as I said, depending on the size and the nature of the polyp, we'll decide when to repeat the colonoscopy. Most of the times it's like 1 or 2 polyps, we repeat the colonoscopy in 5 years time.
Okay.
But if it's more than 3, then we do it like every 3 years for them.
Do they grow? Are they?
Yes, so most of the time the polyp, they grow slowly. So for a polyp which we see at like a 5 millimeter size to turn into cancer, it might take like a good 10 years or so. So they're like really slow growing, unless it's like an aggressive kind, which again is not that
Sure.
the norm.
How does it spread then to other organs? How does that happen?
So the cancer can spread either through the blood or through lymphatic or the tissue kind of fluid. So usually cancer kind of first goes to the lymph nodes in the draining area, and then sometimes from there it can even spread to the liver, and then from the liver it can further spread to your lungs or to your brain.
So that's why it's important to get it right away.
Yes.
Yeah.
Yeah, once it has spread, gone into the liver, lungs, at that time the treatment is more to keep the cancer under control rather than a curative kind of surgery, unless it's like a very limited like liver spread or very limited lung spread.
Okay, now, and as a surgeon, you would cut out pieces, right, of the
That's right.
colon if it looked like it was, were there too many? Is that the reason? Too many polyps in that area, or what would you do?
No, generally, like if the polyps, like if there are too many polyps and we still spend some time in colonoscopy and try to take all the polyps out by colonoscopy, we try to keep surgery as a last resort.
Okay.
But there are, like when you say too many polyps, there is one hereditary condition, it's called familial adenomatosis, Polyclosis, where patients can have thousands of polyps. In those cases, yeah, you just take the colon out. Again, like if the polyp is big that you can't take it out safely by colonoscopy, then yes, you have to go and resect that part of colon out, because you don't want to create a hole in the colon while doing a colonoscopy. Then it kind of creates an emergency situation wherein you have a hole in the colon and then you have to plan the surgery in an emergency way, and there's like spread of stool within the
Sure.
belly.
If you do take a part of the colon out, we can still have normal lives, right?
Yes, yes. So you can have a normal life even without your whole colon.
Really?
Yes. There are some conditions wherein we take the entire colon off, entire rectum off, so people can live a normal life with that. Maybe they might have little extra bowel movements that way, but still they pretty much lead like a normal life.
Oh, wow, that's great
Yes.
to hear. How have things changed in your field over the years? I'm assuming in the early days,
Mhm.
it was really scary.
Yeah, so there are like one is more awareness of colonoscopy, so that's why people are getting the colonoscopy done sooner, and we are catching we are not seeing that many colon cancers because of more colonoscopy being done and people being caught at an early stage. And B is there's something called Cologuard, which is kind of alternative to colonoscopy. I'm still like not fully sold on the getting a Cologuard when I think colonoscopy does like a good
Sure.
job of looking things, but there are some people who are like really scared and they don't want to do colonoscopy. In that case, I would encourage them to do at least a Cologuard.
Is that like a home
Yeah, this
kit thing?
is a test wherein a person would evacuate or have a bowel movement in a container and send it out by FedEx to the company. It's based in
I'm
Minneapolis.
not doing that.
Yeah, it's based in Minneapolis, and they check a lot of the genes shed in the stool, and based on that they can come up with kind of like a probability whether you have polyps or not, whether you have cancer or not. And if that shows that possibly that you have tested positive, which means there's like a probability of you having a polyp or cancer, then you need a colonoscopy. That's the next step. So that's another like advancement. The other advancement is in the surgical techniques. Previously it was all just open surgery, big incision, but nowadays we do it using robot. We do
Oh,
do it
really?
using laparoscope. So the incisions are real small, and there's like a shorter length of stay in the hospital, faster recovery, less pain. So and also we have noticed that from a cancer standpoint, to outcomes are really good when the incision is small. The way the tumor responds to chemotherapy after like doing a smaller incision surgery is better compared to a big open incision.
How is it doing robotic surgery? Is that fun?
It is fun.
Is it like playing
It's-
a video game or something?
It's kind of video game, we can say. Yes, it's fun. It's more ergonomic too, because like rather than standing and kind of straining your arms when you do laparoscopic, if you're sitting very comfortably on a chair and kind of very relaxed, you've got a good body posture, so you don't feel that tired at the end of the day of after doing a big case.
Well, I think I might want your field. I didn't think I ever did, but now it might be kind of interesting.
It's not never late.
You know, well, now, what else do we need to tell people about all of this stuff we need to know? Is it, when you get closer to 50, should you try and do this stuff when it's near your birthday so you remember to do these things, or?
Well, some people do definitely wait for their birthday. They know it's like a 50th birthday gift. But yeah, I mean, that's just an arbitrary number. So yeah, you don't have to exactly do when you're 50. Maybe 6 months or 1 year.
Sure.
Plus minus 50 is also fine.
But it's a matter of paying attention. That's the key.
Yes.
And if you notice any differences, you cover all those things.
Yes.
So that if I ended up, I had some problems, you're the person I need to come to.
Yes.
Right?
Yes.
Well, thank you so much. It's so good to see you again.
You're welcome.
And to find out all this stuff, I'm glad to know there are advancements. And I'm glad to know that I don't have to take that awful drink anymore.
Yes.
Because that was just dreadful. But the best thing about a colonoscopy is having a piece of toast afterwards.
Yes.
It is like the best
It-
toast ever.
It really tastes good. This is what I heard, because you're starving kind of starving for the day before, and then your belly is fully empty. You're starving, so
Anything is
the
good, I
toast
suppose, but
is
I
good.
really loved it.
Yes.
I thought it was great. Thank you so much.
You're welcome.
Have a great one, and make
Thanks for
sure you
doing
get
this.
your colonoscopies when it's time.